Now let's smile, please. Let's laugh heartily. Let's leave it normal. Nose filler procedure will be performed. The patient's nasal condition is satisfactory. The patient had a nose filler procedure done before. Today we will provide support to an area that requires a bit more maxillary spine reinforcement. We will achieve a slight elevation of the nose and make it appear shorter. With an application we will perform on this part of the nose. We are also elevating the supratip area of the nose again. Let's start by performing an application on the patient's maxillary spine. We need to carefully inject just below the crack that has formed in this area here. You know there are collimators on the left and right. Therefore, our designated injection area will be quite deep. There is an empty space about the size of a hazelnut inside. At that point, we slightly retract our needle backward so that it will touch the maxillary spine at the midpoint without turning it too much to the left or right, ensuring that there is no pain in that space, approximately 0. We will offer about 2 items. I will initially enter at a precise 90-degree angle during this entire process. Starting the injection, after that I will carefully lift my needle slightly upwards to inject a precise amount of product under the nasal depressor, located just below the nasal septum, which you can visualize as a triangle with the maxillary spine positioned at the top point. This technique will assist me in achieving maximum upward projection and fullness in the overall appearance of the nose. Let's begin our application process. I carefully made a tiny needle entry right at that exact midpoint. I move my needle ahead. As soon as you enter here, you sometimes touch the maxillary spine. If you are touching it, it already means that very few patients in this area need fillers. The projection is good. Finding yourself in a deep void can happen when you're stuck with your needle. The tip of your needle does not touch anything. You don't need to press too hard to make contact there. Our needle is 8 mm deep with the thickness of a 30-degree Botox injector. Simply place the product in this space provided. If you feel that emptiness, meaning you can't touch the spine, there is a great need for products in that area. This means you need to have at least 0.20 available. But as I said, if you catch the vibe when you touch it, sometimes you don't need to give anything at all. I'm 0.50. One product will be sufficient. Starting my injection now, I carefully pushed my needle forward. I'm slowly starting my injection, 0.5 right now. I slightly increased it a bit more than before. I have now confidently turned my sewing needle upwards towards the fabric, but I didn't pull back. I am currently still under the nasal depressor known as septa nasica. I also want to provide additional support to the area located in the lower third of the septum, and here approximately. I successfully provided the product on the date of 20.3. I'm pulling my needle back a bit now. I'm slowly getting out. After I leave the clinic, I gently press on the treated area to ensure that my filler isn't applying any unnecessary pressure on my nostrils or causing discomfort inside my nose. First injection site completed. Secondly, I will continue with my injection in the supratip or tip area. We will try to determine the elevation point at the tip of the patient's nose, friends. In female patients, if the nose is somewhat long, we prioritize making the injections as high on the supratip as possible, aiming to create the illusion of a slightly shorter and more balanced nose. For male patients, it may be more logical to fill the point between the type and supratip, as we are aiming for a more blunt and flat nose. Focus on the degree of sagging in the septum. If the septum has sagged down significantly and the nasal wings have risen up considerably, then when you go very supratip, you will achieve a significant elongation at this distance in front of the nose, making the septum of the nose appear even more droopy. It would be better to have additional tailored injections for the type. We are trying to decide on the injection site for this patient by lifting the fat tissue between our 2 fingers just below the skin. Yes, I thought that an injection I would do at this point would look quite nice on the nose. This patient has a history of nose filler. Today our goal is to enhance the projection of the nose slightly more and also to restore the volume that has diminished over the years. Starting the injection now. I'm currently utilizing microfine Botox injectors, my friends. As I mentioned earlier, these are specialized needles that measure 8 mm in length and have a width of 30 G. I prefer products from the BD brand. The lumen widths are beautiful and fluidity is excellent. The critical point here is how the syringe is prepared. Perhaps we will be shooting a video about this and sharing it. Another important aspect to consider is the products. Do not fill more than 0.20 or 0.25. The injection will significantly prevent you from applying the desired amount of force effectively due to the noticeable decrease in your pressure force at this distance. Therefore, for my female doctor friends, 0.10, 0.15 for my male doctor friends, and 0, nothing else. Prepare draw products up to 0.20, 0.25, but it may not always require this many products, patients, checkups, etc. Therefore, I have approximately in my clinic Aero 5s, 0.1s, 0. I prepare a total of 10 syringes, each with a 0.15 ml difference, and I use as many as I require at that specific moment. This way, you will have the opportunity to apply it for different patients from a single box. I'm starting my injection now, friends. I gently supported this important point with the tip of my finger. I utilize my other finger to offer additional support from above, carefully projecting the specific point I wish to elevate upwards. By slightly twisting it with my hand, I enhance this projected point, making it more distinct and noticeable, thereby creating a clearer visual differentiation. I lifted the subcutaneous fat tissue upwards thoroughly. I am now inserting my needle into the point where I want to make the injection. The critical point here is that your needle should be inserted about 4 millimeters deep into the skin. Look, this is an 8 millimeter needle. We are trying to achieve projection by placing a hyaluronic acid filler under the subcutaneous fat tissue at a depth of 4 millimeters. If you go in as much as 8 millimeters deeper during the procedure, this time you will have successfully entered between two cartilage pieces, resulting in a widening effect on the tip of the nose for a more pronounced shape. In certain situations, especially post-surgery, rounding and widening the tip of the patient's nose is essential. In such cases, we perform deep injections, but for patients where you want to slim the tip of the nose, a depth of 4 millimeters is sufficient for us. If you inject closer to the surface, the Tyndall effect occurs, the tissue becomes a bit more distorted, and you encounter some redness. Therefore, a depth of 4 or 5 millimeters is sufficient for us. Current depth of my needle is visible. Approximately half of the needle is inside. I'm starting my injection now. I am squeezing that small gap extremely tightly with my two fingers to effectively prevent the filling from migrating or leaking to the sides. I feel as if my fingers are sliding sideways, depending on how tightly or loosely the filling is packed inside. Still receiving injections. It was 0.05 so far. I came at 0.01. I want to give a little more. I will keep injecting until 0.12. Yes, I stopped what I was doing. I'm carefully and slowly pulling out my needle, all while checking the elevation at the tip of the nose from the side. What I need to do now is carefully raise our close-up camera upwards to focus on it more effectively. There will be a flattening occurring in this area. It would be nice to soften the transition by filling in a bit between the flattening at the super tip point and the flattening between the dorsum. Some patients here appreciate the unique aesthetic effect of a broken nose. You can proceed by consulting with your healthcare provider or doctor for further guidance. Now I'm coming to the injection point. I raised that point quite a bit with my two fingers pointing upwards toward the sky. So I again prolapsed the subcutaneous fat tissue upwards and lifted it. I'm carefully pushing my needle in approximately 2 millimeter deep this time. Go to that point only. I am injecting from 2 points between 0.001, 0.02, which are the points where I saw the depressions. Not every patient needs this injection. You will decide the situation based on your needs. After the precise injections you skillfully performed at these two specific points, first at the septum and then at the supertip, you successfully achieve a noticeable improvement in the patient's nasal dorsum. From this point forward, the decision of whether to inject into the nasofrontal angle located between the patient's glabella and the dorsum is entirely up to your professional discretion. If you start the injection from the glabella and the nasofrontal angle, you may have the opportunity to elevate this area significantly and create an avatar-like effect for the patient. Therefore, the initial correction should be made on the septum, followed by adjustments to the tip or supratip area, allowing the dorsum to naturally fall back, which will ultimately reduce your need in this area. I will make a small injection now. We have a plan, friends. You are pulling the skin from the glabella towards yourself with your finger. This way you are separating the skin and subcutaneous fat tissue from the underlying tissues. So you are raising this point a bit. Therefore, we will perform a very superficial injection. Your needle will almost immediately enter the skin, reaching the intradermal area. You need to carefully place small papules in this area that are not even as large as this little one, but rather half its size. You should hardly see any bleeding. If you see bleeding, you have gone deeper. It means you have gone under the dermis. We performed an intradermal injection, and there are no anatomical structures at this point that you need to be concerned about. Yes, let's evaluate our patient's nose from different angles. I would like to ask you to smile. I will ask you to kiss. Let's leave it normal. Certainly we can raise the patient's supratip point just a little bit higher for improved aesthetics. However, the current image is generally sufficient for our needs. Application has concluded here.